Let's start by going through how breastfeeding actually works. So, the process of producing breast milk starts with the hormones prolactin and oxytocin. Prolactin is responsible for producing milk in your mammary glands, while oxytocin causes your milk to be released or let down from your breast. In the first few days after birth, your breasts produce colostrum, which is a thick yellowish fluid that's very rich in nutrients and antibodies that's going to help protect your baby from infections. Then, around 3 to 5 days after birth, colostrum is going to transition to mature milk, which is thinner and whiter. So, when and how do you get started with breastfeeding? When it comes to the first latching, it's best to start breastfeeding within that first hour after your baby is born. This early contact is going to help stimulate your milk production and encourages bonding with your baby. Now, you're going to want to find the right position to feed your baby. So there's a number of common breastfeeding positions, including the cradle hold, the cross cradle hold, the football hold, and sideline positions. So find a comfortable position that works best for you and your baby. Proper latch is very important. You want to ensure that your baby has a deep latch and that they are not just sucking on your nipple. Instead, your baby's mouth should cover both the nipple and a good portion of the areola. This is going to help prevent nipple soreness and ensure efficient milk transfer. You'll want to establish a routine with breastfeeding. So firstly, feed on demand. Newborns are going to typically need to feed every 2 to 3 hours. So watch for hunger cues from your baby, such as rooting. This is where your baby will turn their head and open their mouth in response to a touch on their cheek, and they may even bump their head into you, searching for the breast to begin feeding. Your baby may also suck on their hands or smack their lips. So learn to read these early hunger cues so that your baby is offered the breast when they are calm and well before they reach that frantic stage of crying. You'll want to switch breasts during feeding. So let your baby finish the first breast before switching to the second breast to ensure they drink the full milk. So that's the first bit of milk which quenches their thirst, and then they get the hind milk, which is richer in fat and calories. Now, there are some common challenges you might experience when breastfeeding. So the first is sore nipples. And the best way to try and prevent this is to make sure you have a proper latch to prevent soreness. If soreness persists, you want to consult a lactation consultant as soon as possible. Next is engorgement. So if your breasts become overly full and painful, try feeding more frequently, using a cold compress, or expressing a small amount of milk. If you have low milk supply, make sure you feed your baby frequently. Ensure there is a proper latch, stay hydrated, and eat a balanced diet. And you want to do lots of skin to skin with your baby. Skin to skin contact increases low breast milk supply by stimulating the release of the hormones oxytocin and prolactin. Oxytocin is going to help with the milk ejection reflex, while prolactin promotes milk production. And this is going to lead to an increase in overall breast milk supply. The close contact is also going to encourage your baby's instinct to latch and feed, further boosting milk production through that frequent feeding. Consult a lactation consultant if you have any concerns about your milk supply. If your baby is gaining weight and has lots of wet and pooey nappies throughout the day, this is an indication that your supply might actually be okay. Let's go through some tips for successful breastfeeding. So firstly, make sure you stay hydrated and well nourished. Drink plenty of water throughout the day and maintain a balanced diet to support your milk production. If you're struggling or you're sore, don't hesitate to get help from a lactation consultant, join some breastfeeding support groups, or go and see your healthcare provider. You want to create a comfortable environment to feed in. So find a quiet, comfortable place to feed and use lots of pillows to support you and your baby. And you can also set up a breastfeeding basket with some water, snacks, baby books to read to your baby, and anything else you want close by for during a feed. Finally, let's go through some of the beautiful benefits for your baby. So breast milk provides all the nutrients your baby needs for the first 6 months of life. It contains antibodies that help protect against infections and disease. And there are benefits for you as well. So breastfeeding helps your uterus contract and reduces that postpartum bleeding. It can also help with postpartum weight loss and lowers the risk of breast and ovarian cancers. Breastfeeding is such a beautiful and natural way to nourish and bond with your baby. And while it can come with challenges, knowing the basics and seeking support when needed can help you and your baby enjoy a successful breastfeeding journey. Remember, every mother and baby are unique, so find what works best for you and your family.